Now, from ABC4 News, coronavirus preparation versus panic.
Thank you so much for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. Right now, the entire state of Utah under a stay safe, stay home directive from the governor, and residents in Salt Lake, Summit, and Wasatch counties all have orders to stay home. The pandemic has presented unique challenges for the 2020 census. Here to break that down and how the census is adapting and why it's important for every Utahn to participate is Evan Curtis. He is the state planning coordinator for the Utah Governor's Office of Management and Budget. We appreciate having you with us. Let's get right into it. What changes should we expect with the census because of what's happening with the coronavirus?
Well, the biggest changes are going to be in rural Utah. If you're in an area with a P.O. box, you would have received your invitation to participate in the census by now. Unfortunately, that's been delayed because of the coronavirus, and field operations have been delayed a little bit. But the good news is you can still go online right now, and you can still respond to the census. You don't need to wait until you receive that invitation. So if you go to my2020census.gov, you can participate no matter where you're at.
And what are other additional impacts we should keep in mind that the COVID-19 could have on the census?
Yeah, another unique challenge that we're facing is people aren't where they would normally be, and of course that can impact how our state is counted. For instance, college students typically would be on campus right now during the census. Census day is April 1st. And normally all of our college students are at their dorms or they're on off-campus housing. Unfortunately, because of the coronavirus, many of our students have returned home, and we don't want that to mess up the counts. What the Census Bureau is asking that we do is have those college students who would be in college, in their college housing right now, but for the coronavirus, to be counted at their college residences. And so that's going to be a big change, and we need to get the word out on that.
Okay, yeah, these times are impacting. You talked about Census Day being April 1st. That's coming up quick. But when is the census available, and who should be counted?
Yeah, it's available now. Census Day is April 1st, so that's the point in time that we're trying to count. We want to know where you're at on April 1st. But because of the coronavirus, that's another great question, is the timelines have been extended a little bit. There have been some delays. But like I say, for most residents, that's not going to have any impact. You could go online now. You should take it right now and not worry about any of those delays.
Okay. So we're seeing a lot of pushed off. The census is going on. That's because it's really important. Talk about why the census matters to us here in the state of Utah.
Yeah, the census is really important for the state of Utah and for each of our communities for really three main reasons. And the first is funding. We get a lot of federal funding into the state, and we also distribute our state funding based largely off of counts. Anytime you're basing any funding decisions based on a population or demographic number, you're typically referring back in some way or another to the census. And so it's very important that we get those numbers right for funding. The second reason is political representation. From everything I've seen, we're not likely to get another congressional seat, but that doesn't mean that it doesn't impact our political representation. Utah's been the fastest growing state in the nation over the past 10 years, and so we're going to see a lot of changes in our legislative seats, for instance, and how that's distributed. But it impacts every political office, clear down to our local community councils and our school districts as well. And then the third is planning and economic development. When we're planning things for our communities, whether it's transportation, whether it's public safety and fire facilities, we're using population data, and that all comes from the census, and we've got to make sure we get it right.
It can also have an economic impact for us here in the state of Utah. Talk to us about how that happens.
Sure, and I think the biggest thing is going to be, again, the billions of dollars of public funding dollars that are distributed based on census counts. But businesses are also using census data when they're determining where to locate their businesses. So it has an impact throughout many areas of our economy.
And, you know, this has been going on for a while now. Talk about how Utah is doing so far in comparison to other states across the country.
Yeah, so far the good news is we're the best in the West. We're actually leading the charge in all of the western states. We're at about 38.6%, just slightly ahead of Idaho and a few other states. The one challenge, as I mentioned, is some of our counties are falling behind because they're waiting for their invitation to come in our rural areas, and so some of our counties have less than 1% who have responded, and so again, we need to get the word out. We need to keep going. We want to have everybody counted by April 1st, and so if you haven't taken the census yet, we want to make sure you go to my2020census.gov and take the census.
Okay, that's what I wanted to get into next. Is it's pretty simple to go do. You just do it right online.
Sure. It's right online. There's also an option to go on and take it on the phone as well if that's easier for you. But we are encouraging an online response. It's only 7 questions. It takes a few minutes, depending on how many members are in your household. And we do want every member of your household to be counted, whether they're related to you or not. So make sure you count the children. If there are grandparents living with you, they all need to be counted, anyone who's at that address.
And I know I've been contacted via mail at my home a couple times, you know, to give me the information that it's coming up and how to go do that. If we don't do it online, that's when people could potentially come knocking on our door, correct?
Right. That's exactly what will happen. But again, that's one of the big unknowns because of the coronavirus. Our field operations have been pushed back a little bit. The Census Bureau is taking an incremental approach, and so they're kind of taking things a few weeks at a time, like the rest of the world. But there's a chance it could be pushed back several weeks, and so that's why we do want to make sure if you're able to go online right now and take it, go ahead and get it done so we don't have to worry about that.
Okay, Evan Curtis, great information for us tonight. Again, more information online. Give us that website one more time. All your questions can be answered there as well.
Yeah, to find more information, go to census2020.utah.gov.
Okay, fantastic. Thank you so much for your time. We appreciate having you with us tonight.
Great, thank you.
All right, still ahead, we take a closer look at the virus and how it's becoming a challenge for area hospitals. We'll get to that coming up.
You're watching Coronavirus Preparation versus Panic.
ABC4NEWS is putting the focus on preparation versus panic during this pandemic. For more on what you need to know about this virus, its spread, and what you should do if you should become sick, I'm joined now by Dr. Mike Bauman. He's the Chief Medical Officer with Mountain Star Healthcare. Mike, so great to have you with us. A lot of people on edge now. First, what do we know about this virus and how it's spread?
Well, first, I want to compliment you on your social distancing. I'm outside. It's a tad bit cold, but appreciate the question. How do we know? What do we know about this virus? It's very much like in the past MERS and SARS. It's very much to a degree like flu. But the big issue is it's a different virus in the rapidity with which it spreads. So unlike flu, which when you have flu, you might hit 1, 2 people. This hits 3 people, so it can spread very rapidly, which is the main concern we have for the healthcare systems is if we can spread that quickly, we might overwhelm the healthcare systems.
Right.
But all the systems are working very quickly and diligently to prepare for this.
Okay, let's dig into that a little more, and I do like how you brought that up. We are practicing what we preach here, so thank you for that. What do people need to know specifically about transmission?
To know about transmission, number one, this is primarily transmitted through droplets. So if you see me do this right now, it's not because I have COVID, it's because it's cold out here, and if I were to sneeze or cough, droplets come out. Unlike airborne, which is more in the air, so the droplets come out. That's why we should do coughing into our elbow, and also be aware it gets onto surfaces. And it can live on surfaces, we think, for up to 1 to 3 days. So we need to be very careful about cleaning areas where we've been. High-touch areas like doorknobs, tabletops with a lot of activity. Be very careful to keep those clean and at the same time keep your social distancing.
I was watching real-time numbers today, and to be honest with you, it's best not to do that. But what is it that makes this virus so dangerous?
Well, part of it is what I hit just a few minutes ago. It's the rapidity of spread. So it spreads more quickly, so more people can be affected more quickly. Flu happens roughly between September and March. This can happen much more quickly and overwhelm it. Plus, we know in certain age groups, particularly the elderly, and in patients with other healthcare issues like heart failure and diabetes, that they're more prone to having problems. But I don't want the millennials and other young people thinking that they're not immune. They can get this too, and they can end up in the hospital as well.
Yeah, that's something we really saw play out today, and that's the message we're hearing from the state, definitely. Talk about symptoms. What should we be watching for? And if we're feeling those, what should we do after that?
So the most common symptoms that we're worried about is fever, plus cough and respiratory issues, mainly shortness of breath. Those can be, though, a lot of other things, the common cold and the flu, but those are the main symptoms, and that's the tough thing right now is how do you tell flu from COVID? But you need to be careful and keep an eye on those symptoms, and if you have them, stay home, particularly if it's only mild symptoms. If you get worse, then you need to come in and be seen.
Doctor, we've been hearing a lot of people say, I have the virus, I wouldn't even have known it. Why is it that some are asymptomatic and others are showing symptoms, and there seems to be quite a range from mild to severe here? Why is that?
I think it's also part of what I hit just a few minutes ago, the difference between how baseline healthy you are versus how many comorbidities you have. So, for example, the case that was really unfortunate yesterday that we reported was an older person who died in Utah who had other health care issues. So older people are more prone to it, younger people less, but even younger people can get ill. So it's a whole spectrum of how people can be impacted by this.
So as we see the numbers continue to escalate here, how is your organization, Mountain Star Healthcare, and its hospitals preparing and dealing with the growing number of coronavirus patients that you could be administering to?
So we have a very proactive program across not only Mountain Star, but all of our hospitals in what's called Hospital Corporation of America. We're preparing by looking at the number of beds we have, looking at alternative locations where we can have beds within our hospital, repurposing areas like the post-anesthesia care unit where we send patients after surgery. That can turn into an ICU. Taking areas that are perhaps administrative where we can move patients in there as long as we have all the available equipment like oxygen and suction. So we're looking at available space and how we repurpose it to be prepared for more patients coming in if and when, and unfortunately probably when, we get this surge.
Let's talk elective surgeries. We're seeing organizations take action there. What do you guys plan to do, and what does that mean?
So what are elective surgeries? And this has been a hot topic, not just here in Utah, but elsewhere. The first thing to understand is elective surgeries are those surgeries that are already scheduled. In our organization, we've been following the CMS guidelines, and they actually have a tiering of what should or shouldn't be done with surgeries. And we very proactively review in our hospitals, often with our CEO, our chief medical officer, surgeons, to look at that surgical schedule and be sure, is this someone should have it? I want to make a comparison. Someone who's coming in for, quote, an elective scheduled lumpectomy of the breast could have breast cancer versus someone who comes in for breast augmentation. Those are two different things. The breast augmentation should be put off. The lumpectomy, even though it might be in one of those lower tiers, really needs that to be done because it can be life-saving because the individual could have breast cancer.
Got it. That makes sense. We've run out of time, but real quick, I do want to let our viewers know how they can learn more about Mountain Star Healthcare and its hospitals. What's the best way to reach out?
To reach out to us, actually we have multiple hospitals, St. Mark's, Lakeview. That's actually a great question, and I'm going to pass it to our PR folks to make sure we get, what's the best way to get a hold of Mountain Star Health quickly. We have Brigham City, Cache Valley, Ogden Regional, down to Lakeview, to St. Mark's, to Lone Peak, to Timpanogos, to Mountain View Hospital. That's our system.
All right. There's one near you. So much panic out there. It's nice to get answers. Thank you so much, Dr. Bauman, for your time tonight.
This next step we'll call Stay Safe, Stay Home. Stay safe, stay home. There's no better place for you to be safe than at your own home.
Coming up, the state is under a Stay Safe, Stay Home directive from the governor. How it compares to mandatory county stay-at-home orders.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
Okay, so I'm going to contaminate myself. So, start by wetting your hands, getting them soaked, and you want to lather first, palms together. Then you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs. It's kind of a circular motion around your thumbs, other thumb, and then the palms of your hands, you do the fingertips around the palm in a circular motion. Get your fingertips nice and clean. And the other hand, and then my wrists. And that was 7 different steps, and if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy, and those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
You're watching Coronavirus Preparation versus Panic.
We're back now with more on the governor's directive aimed at slowing the spread of COVID-19. Stay safe, stay home. ABC4's Brittany Johnson breaks down what you need to know.
The governor says this is not a shelter-in-place order, but rather the next step in his plan called Utah Leads Together.
We're in the throes of a challenging time.
For that reason, Governor Gary Herbert announced a new directive on Friday.
Stay safe, stay home. That's the phrase.
Governor Herbert says doing the following will help slow the spread of COVID-19.
Work from home whenever possible. Encourage phone and video chat, self-quarantine. If you've been away or if you've been exposed to somebody who has COVID-19, then you should, of your own volition, self-quarantine. We need to engage in what we call appropriate social distancing. That's the new part of our vernacular now that we're getting to use all the time, social distancing. It's the physical distance between you and an individual. It should be at least 6 feet.
The governor also doesn't want people shaking hands. He says cut down on the amount of times you visit friends and family unless there's an urgent need. Limit trips to the grocery store to once a week. And he wants all high-risk individuals to stay home.
This is something we expect all Utahns to do. This is a directive to the people of Utah. It's something that will only work if we all participate and do our part.
The goal: flatten the curve and reduce the strain on hospitals.
And if we do this, we're going to come out, I think, in good shape over the next few weeks.
On the heels of the governor's directive, Salt Lake City Mayor Aaron Mendenhall is taking it one step further and enforcing it by law, meaning you could face a Class B misdemeanor for non-essential activities.
This is the right thing for the people of Utah because just like air quality, COVID-19 doesn't respect jurisdictional boundaries, and it is a threat to our entire state right now.
You can learn more about what is an essential activity in Salt Lake City on our website, ABC4.com. From reporting in the control room, I'm Brittany Johnson, ABC4 News.
Today is the first day of a new public health order in effect in Salt Lake County. The county is requiring some businesses to close. These would be beauty salons, gyms, and other non-essential services. The county is also placing social distancing restrictions on food services and other essential businesses. Now, unlike the governor's directive, both Salt Lake County and Salt Lake City mayors are making the order mandatory, which means if you do not follow it, you could face a misdemeanor. Salt Lake County's order remains in effect through April 13th, Wasatch County's through April 14th. Summit County's stay-at-home order went into effect Friday, March 27th, and goes through May 1st. The governor's directive places restrictions on recreational outdoor activities. State parks are open only to residents who live in the county the state park is in. The governor says you should not congregate with others at parks or outdoor space, and he advises not to participate in any close contact or team sports.
There's really no need to call us. You file your claim. If we have any questions, we'll call you.
Coming up on coronavirus preparation versus panic, the pandemic is sending unemployment to levels we've never seen before, but help is available for Utahns who are out of work.
You're watching Coronavirus Preparation versus Panic.
In the midst of the pandemic, unemployment numbers have reached record highs. State officials are seeing a 1,400% increase in claims. As ABC4's Jason Wynn shows us, the Department of Workforce Services is prepared to help.
COVID-19 is changing the way of life for many Utahns.
It has been very scary to think about. I know we have enough to get us through, 30 days of this.
Ariana Hone and Eli Hayes both work in the food service industry. Newly released data shows 37% of unemployment insurance claims come from their industry, the hardest hit. Hayes says he was furloughed before St. Patrick's Day and filed for unemployment benefits.
I got online pretty much as soon as I lost my job. It all seemed really straightforward.
Before March 15th, the State Department of Workforce Services handled roughly 1,300 claims. From March 15th through the 21st, nearly 19,600 new claims came in.
It actually increased by 1,400%. So it's the highest claim volume we've seen.
Kevin Burt oversees the state's unemployment insurance division. He says people will see high call-in wait times and advises applying online, allowing workers to process everyone's claims.
There's really no need to call us. You file your claim, and if we have any questions, we'll call you.
He says employers should be upfront with employees.
So then when they apply, we know that their intention is to return, and we'll do what's called job attachment. We'll attach them to that employer and not require them to job search.
As a salaried manager, you kind of assume, to some extent, your job is kind of safe.
Matt Parks hopes he can still manage a team when the pandemic is over. Office administrators and managers like him wrap up the top 3 hardest groups hit by unemployment.
It'd be nice if everything was over by Easter, but I think the reality of it is that's not the case.
And if you think you should wait to file unemployment, know this.
What we're seeing is that we're seeing similarly high volumes this week as we did last week.
Bird tells me the federal unemployment benefits, that $600 is coming to folks, but it needs to clear a couple of federal hurdles before the state's able to distribute it. I'm Jason Wynn in Murray, ABC4 News.
And by the way, Salt Lake County made up 47% of the recent unemployment claims. That does it for us tonight on this special edition of ABC4 News, Coronavirus Preparation versus Panic. As we learn more about this pandemic and new measures to prevent the spread, you can count on us to bring them to you. Stay with us, both here on air and online. You can always find us at abc4.com. You can find us on Facebook and Twitter as well for the very latest. Just log on and search ABC4 News. Thanks again for joining us. We will see you back here tonight at 10. Stay safe.